So we've all heard of the hip flexor or the psoas. Now this muscle can actually be quite tricky to release on our own, but I'm going to show you the best ways that I found that can actually help release this using a lacrosse ball. So the first area we're going to go to is actually in the lower back. So the psoas actually connects the femur, this bone in the thigh, through the pelvis and connects it to all 5 of the lumbar vertebrae. So we're going to start there first. Now we're going to actually target more so the QL. You see, when the QL contracts, it actually creates a hyperextension through the lumbar spine. Exactly the same postural position that happens when the psoas is tight. So we work in this general area, we're going to release a little bit of tension here before we go to work in the second area I'm going to show you. So taking the lacrosse ball, bring yourself down onto the ground. Whichever side you're going to put it on, the foot wants to be flat as so. We're going to lift the hips slightly, and you're going to find the top of the pelvis, and you're going to find the bottom rib. We're going to go in that general area, but you're not going to go on the spine itself. Remember, we're looking at soft tissue. From here, you're going to ease yourself back down onto the ball, making sure nothing's too painful. Now at first, you may find it tricky to find an area that feels quite tender. That's fine. You may just feel it quite dense. This is perfect. The aim is to focus your breathing into this area and allow that ball to sink in slowly. Remember, we're not working to make any pain occur or too much discomfort. Remember, you're not going to go on the spine, you're not going to go on the back of the pelvis, and you're not going to go on the ribs. Now, be very gentle in this area as well, because we know this is where the kidneys are. So nice and easy does it. Holding with nice controlled breathing up to about 90 seconds per side. Now, from there, now we've released a little bit of tension in the lumbar spine. Now we're going to go to the front of the hip. Now, the psoas itself, when we do manual releases, we want to get inside the hip on kind of the anterior surface of the ilium. Now, we can't really do that with a lacrosse ball, but we can get close to it. So you're going to find the pointiest bit of the front of your pelvis, place the ball there, and you're going to come just inwards very, very slightly. Now again, this one is going to be very gentle. So bring yourself down with the ball in place. I want you to go into this bit, and I want you to kind of feel and maneuver the ball around the line of the hip bone, just on the inside. So you're not on the hip bone, you're just above it, folding it around. Now again, you may find areas that feel like a little bit of burning. We're just getting into the fascia there. This is what we're looking for. Now from there, we can actually start to tuck the pelvis under gently if we can. And we can just inhale and breathe. As you exhale, we're looking to feel the fascia kind of melt away and the ball sinking that a little bit further. Now remember, if any of these create any pain or too much discomfort, then obviously stop doing what you're doing, and by all means give us a shout and ask us any questions, and we'll be happy to help. So as always, give it a try and let us know how you get on.